As parents, we are always on the lookout for anything unusual in our children, those subtle changes that can signal something might be amiss. It is a natural part of caring for our little ones, constantly observing their behavior and appearance. Sometimes, a specific physical sign can be a quiet but important alarm bell, making us wonder what it truly means for their health and comfort. Yes, sunken eyes can absolutely be a significant and serious indicator of dehydration in a toddler. When you notice this particular sign, it is a strong message that your little one might not be getting enough fluids, and it truly warrants your immediate and careful attention. Dehydration fundamentally means that the body has lost too much fluid for more than it has taken in. Our bodies, and particularly a toddler's rapidly developing system, are largely composed of water. This water is essential for every bodily function, from regulating temperature to transporting nutrients. When these vital fluid levels drop significantly, the delicate tissues and fat pads around the eyes, which are naturally plump with water, begin to lose their volume. This loss causes the eyes to recede slightly deeper into their sockets, resulting in that distinct sunken appearance. This physical change is often more pronounced and noticeable in young children because their bodies have a considerably higher percentage of water compared to adults. They are also much more vulnerable to rapid fluid loss due to factors like higher metabolic rates and a larger body surface area relative to their weight. Common culprits for this fluid loss include persistent fever, bouts of vomiting, frequent diarrhea, or even just an insufficient intake of fluids, especially during illness or warm weather. It is the body's very clear and urgent way of signaling a serious fluid imbalance that needs to be corrected quickly. If you observe that your toddler's eyes appear sunken, it is a critical moment to act both promptly and with great care. Your first priority should be to offer small, frequent sips of an appropriate rehydration solution. This could be an oral rehydration solution specifically designed for children, plain water for older toddlers, or breast milk if they are still nursing. It is important to avoid giving sugary drinks like juice or soda, or large quantities of plain water to infants, as these can sometimes disrupt electrolyte balance further and potentially worsen the situation. As you are focusing on rehydration, continue to closely monitor your child for other accompanying signs of dehydration. These might include a noticeable decrease in the frequency of urination, a mouth that feels unusually dry and sticky, a lack of tears when they cry, or an overall unusual lethargy and reduced energy. If these signs persist or worsen, professional medical advice is essential. It is important to understand that sunken eyes are generally considered a more advanced and serious sign of dehydration compared to earlier, milder indicators such as dry lips, reduced wet diapers, or simply feeling thirsty. Many health professionals refer to this specific presentation clinically as enophthalmos, underscoring the critical nature and diagnostic value of this symptom. Another very significant clue, often overlooked, is a decrease in a toddler's tear production when they are crying. If your little one is visibly upset but produces no tears, or very few, this observation, combined with sunken eyes, truly highlights a deeper state of fluid depletion within their system. Recognizing these specific nuances can significantly aid in a timely and effective response. By being able to accurately recognize sunken eyes as a critical and late-stage indicator of dehydration, you gain a deeper understanding of the significant fluid imbalance occurring within your toddler's delicate body. Knowing precisely why this visible change manifests and understanding the immediate, appropriate steps to take empowers you to intervene swiftly and effectively. This informed approach ensures your child receives the necessary fluids promptly, thereby helping them avoid more severe health complications. Your keen observation skills and quick, knowledgeable actions can truly make an enormous difference in restoring their essential hydration and promoting their overall well-being and comfort.